Good morning. I'm Mike Berkley. I am the founder and director of the Berkley Center for Reproductive Wellness. You can reach me at 212-685-0985. Today I'm going to talk about the acupuncture protocol of doing acupuncture to a patient pre and post embryo transfer. So this is a video really for acupuncturists as well as for patients. So why do we do acupuncture pre and post embryo transfer on a female patient who's going in to do an in vitro fertilization with embryo transfer? This is a standardized protocol in acupuncture, and there's literature behind it and studies behind it that indicate its efficacy. But what is actually happening? So I'm going to give you my opinion, and it's nothing more than that. So when we treat a patient pre-embryo transfer, we are increasing hemodynamics to the uterus. We are increasing hemodynamics to the endometrium. As a result, this will create a healthier endometrial lining, and a lining that is more amenable to an implantation of an embryo. When we do acupuncture pre-embryo transfer, it has the effect of greatly stimulating blood flow into the uterus and increases permeability of the endometrial lining, as I said, to therefore help facilitate an implantation. This is especially true of a blastocyst transfer, since a blastocyst will implant within 1 to 2 days. If we do acupuncture treatment pre-embryo transfer on a day 3 embryo, I'm not so certain as to the efficacy, because when a patient transfers a day 3 embryo, it won't implant for between 2 and 3 days later. So is the work that we're going to do pre-transfer still going to be effective and potent 3 days later? I don't have the answer. Now, why do we treat women who did an embryo transfer post-transfer? Well, there's a very good reason for that. So the uterus can be envisioned as such. If you took 2 8.5 by 11 sheets of paper and put one on top of the other, that's what the uterus kind of looks like. It's flat, and the top and the bottom are touching each other. And so when the reproductive endocrinologist inserts a catheter through the vagina, into the cervix, into the uterus, to deposit the blastocyst, the 5-day embryo, the tube that is being used, the catheter that is being used to insert the embryo, is certainly going to touch either the sides or the top or bottom of the uterus, causing uterine spasming. As a result of this spasming, retrograde flow of the embryo may occur, causing an ectopic pregnancy. And so when acupuncture is provided to a patient soon after transfer, it either stops or greatly reduces uterine spasming, and thereby reduces an ectopic pregnancy, and therefore increases the chances of an endometrial, of a uterine implantation. And so this is my interpretation as to the benefit and efficacy of treating a patient undergoing in vitro fertilization pre and post embryo transfer. If you'd like to find out more about me or the Berkley Center for Reproductive Wellness, you can do so by visiting www.berkleycenter.com. That's Berkley center.com. And you can reach me again at 212-685-0985. As usual, it's been a pleasure to communicate with acupuncturists out there treating fertility cases as well as prospective patients. Thanks very much for listening, and I wish you a great day and wonderful success on your journey. All the best. Bye.